goals. Active surveillance has also become more common and is still a relatively, I think, new field or new practice for many endocrinologists and surgeons. As many of you know, that the data out of Kuma Hospital over the years has shown that active surveillance, which is close monitoring of diagnosed thyroid cancer without performing surgery or other interventions, has met with significant success in avoiding surgery. Often this is considered sort of a surgical delay. And so the surveillance would continue until there are changes to the tumor, changes to the patient's preference, or other circumstances that might result in intervention. Patients that would fit into the category of being appropriate for active surveillance typically have very low risk tumors. And so a more accepted patient population for this would be patients with papillary thyroid microcarcinoma without extrathyroidal extension, without nodal disease or distant metastases. In addition, active surveillance can be used for patients where surgery may be higher risk than the disease itself, due to the patient being a high-risk surgical candidate, have short life expectancy, or have concurrent medical or surgical issues that need to be addressed prior to surgery. But again, we're going to be focusing on patients with low-risk tumors.